The first high quality randomized control study was published by Dr. Ari Levine in a group of children with Crohn's disease. This study largely came out of a group in Israel with a Canadian component. Now, the Crohn's disease exclusion diet is a whole food diet that is coupled with oral nutrient supplements designed to reduce exposure to dietary compounds, which are hypothesized to negatively affect the microbiome, the gut mucus layer, and the immune function of the intestine. We briefly reviewed some of these dietary components in the previous section of this talk. In this large randomized controlled trial, 40 children were assigned to receive either the Crohn's disease exclusion diet together with oral nutrient supplements or another gold standard therapy called exclusive enteral nutrition. This study was rolled out over a 12-week period. At the end of the 12 weeks, the study results identified that 76% of patients who received the Crohn's disease exclusion diet were in fact in remission after use of the diet plus the nutrient supplements alone in patients who received the Crohn's disease exclusion diet compared to those that did not. Now, also importantly, looking at the level of inflammation specifically in the gut through a biomarker called fecal calprotectin, there was a significant improvement in the burden of intestinal inflammation as measured by this important stool sample. Now, the authors concluded that the Crohn's disease exclusion diet, which uses a whole food diet delivered together with oral nutrient supplements, was effective to induce remission in children with mild to moderate Crohn's disease. Very recently, the same study has been evaluated in adult patients with Crohn's disease with very similar findings. Now, in 2021, another important study was published comparing two different types of diets in Crohn's disease. So the dine CD study, which stands for the Diet to Induce Remission in Crohn's Disease, was a randomized controlled trial comparing the effectiveness of the Mediterranean diet and the specific carbohydrate diet to resolve symptoms and inflammation in patients with Crohn's disease. This study was conducted in 33 sites across the United States. And adult patients who had mild to moderate symptoms were eligible to participate. In order to participate, however, stable medications and doses were required. For the first 6 weeks, participants received weekly delivered meals consistent with their assigned diet. After the next 6 weeks, participants were taught on how to prepare their diet. Now, as I indicated to you before, the Mediterranean diet was found to be protective against people developing new onset Crohn's disease. So for that reason, the Mediterranean diet was one dietary pattern that was of interest to this study. Now, the specific carbohydrate diet is another commonly used therapeutic diet for Crohn's disease, particularly in pediatric Crohn's disease. And it's characterized by certain allowed foods and excluded foods. At the end of these 12 weeks, both diets resulted in improved symptoms in close to 40% of patients. Other improvements included overall quality of life, fatigue, importantly, sleep quality. These three factors improved during the course of the diet, regardless of which diet was assigned. Now, looking at markers of objective inflammation, there were some improvement in inflammation, particularly in those that were assigned to the specific carbohydrate diet. At 6 weeks, those in the specific carbohydrate diet reported a decrease in fecal calprotectin that occurred 35% of the time. And 26% of the time, patients reported a decrease in fecal calprotectin at week 12. So overall, a quarter of patients had significant objective evidence of decreased inflammation at week 12. So the authors concluded that potentially there's a role for both diets in the management of their Crohn's disease, but perhaps the Mediterranean diet may be preferred due to its well-documented effects on overall health. However, as you can see here, although many patients had improved symptoms and quality of life, which are of course very important markers, the objective evidence for inflammation still only occurred in a smaller subset of patients.